Chinedu Okpara is in his 50s. He walks into a local health facility in this community in Abia State, where he meets the nurse on duty.
Good afternoon. You're welcome.
He presented his symptom to the nurse, and one can hear the palpable trust in his voice.
Okay.
The nurse listens to him with rapt attention and goes ahead and takes his vitals. Recording every details. When she was done, she picked up a telephone laying on the table and dialed a number. For Nurse Ngozi in this other health center in Ward 3, Umaya North, it's another day in the office. A patient walks in and presented her symptoms.
You're welcome. How are you? What of your family? You're welcome. What can we do for you?
In the past, Nurse Ngozi would have been afraid to attend to her because of the fear of the unknown, as she isn't a trained doctor. But today, she listened with rapt attention, and when she was done, she took the telephone and dialed a number. On the other side of the lines are trained physicians. They are doctors trained to take these calls and are the reason these nurses in our story are confident. They are part of the team who makes up the Dial a Doc, the Abia Telehealth Initiative.
I'm Dr. Chimobi from Dial a Doc Direct, Abia State Telehealth Initiative.
I'm Dike Ngozi, OI Samuzuku Health Center.
Yeah, good morning. How may I be of help to you?
Doc, I have a patient.
At the inception of his administration in 2015, Governor Okezie Ikpeazu identified sound healthcare services as one of the enablers of his 5 development pillars aimed at delivering better life to the people of Abia State, and proceeded to map out and implement strategies to ensure improvements within the sector through capacity building, deployment of technology, modern equipment, and well-defined deliberate actions to be taken to ensure that life expectancy in the state surpasses the national average. And one way it is doing this is through the Abia Telehealth Initiative.
Telehealth is an initiative that connects our entire health architecture to a team of doctors, because we understand that we can't put doctors in every primary healthcare center. We have a hub where 15 doctors or so walk around the clock, and they speak all the dialects, vernacular and everything there.
When Governor Okezie Ikpeazu conceived the Telehealth Initiative, many cynics saw it as a jamboree and a project that is an exercise in futility. But Governor Ikpeazu, undaunted, forged on with the plan. Then came COVID. With the streets of Abia State and Nigeria locked down, healthcare and visits to the hospital became a luxury. Thank goodness for Governor Ikpeazu's vision. The telehealth came to the rescue as it became a veritable vehicle that Abians used in contacting doctors and getting treatment.
That speaks to a lot of things. That speaks to vision. That speaks to commitment. That speaks to proactivity. To a different level, it might even be said to have spoken to clairvoyance, because it was very difficult to sell this idea to the leadership, you know. But immediately we engaged Dr. Ikpeazu, His Excellency, Governor of Abia State. It was like we had that discussion before, and he says in his words that he had always known that destination of healthcare is digital. That's a phrase I use now, you know. And then he was committed to it. He had absolute clarity of where he wanted to go with the telehealth vision. And that's where we are here today. And then came the COVID. When COVID came, it sort of gave it a stamp of justification for our existence. And Dr. Ikpeazu was way ahead of time. We were institutionalized 2-3 years before the COVID.
The Abia State Telehealth Initiative is an indigenous initiative that leverages simple and available telecommunication technology to improve access to quality healthcare and universal coverage of services, hence the term telehealth. Launched in April 2018 in Umuahia by the Vice President of Nigeria, Professor Yemi Osinbajo, who lauded Governor Ikpeazu for bringing the initiative. The telehealth, or Dial a Doctor Direct initiative, has the mission of leveraging simple and available telecommunication technology to promote good health in Abia State through phone calls.
With this telehealth support center, also known as the Dial a Doc initiative, I'm told that citizens can now, through a dedicated telephone line and affordable prepaid cards, access medical care and support from a statewide network of doctors who will be able to communicate even in local languages. We've listened to Dr. Omas, who has spoken to us extensively about the uses of this, and we have seen it actually being demonstrated. We have seen a person who actually called the telehealth center and was attended to by a doctor. This is a very commendable initiative indeed.
So Nigeria has about 200+ million people, where we have access to basic health care between 35 to 45%. Well, Nigeria has a tele-density of 108%. It means there are more phones in Nigeria than human beings. The telecom sector is the biggest service provider in the country today. And then we're seeing how the West is leveraging on simple telecom to drive access to other service sectors. So I think the question was, why are we not doing this in healthcare?
Well, since 2017, it's already been in the grassroots, because we started on an institutional model whereby we integrated all the health centers. And you believe that you know that health centers are already in the grassroots. We're not talking about general hospitals or tertiary hospitals. We're talking about health centers. So it's already in the grassroots. And these health centers are managed by nurses that we call OICs. So they come to work and they take patients. Now, this is what happens. When they have cases they can handle, fine and good, because they already know what they are doing. But if they have a case that they need a doctor's opinion, that's when they call us. And if necessary, sometimes we tell them to give the phone to the patient there in their locality, and we talk directly with the patient. So what we'll now do is to remotely manage the patient with the nurse. And if we sense a limitation in their resources, we also advise them to refer.
When I call the doctor, I will tell the doctor my name, where I'm calling from, then I will find out the doctor I'm speaking with. Then I will tell the doctor the client's name, her age, and the complaint the client came with. I will also tell the doctor the vital signs that I've taken. If I've started any treatment already, I will then tell the doctor, see the treatment that I've started already. Then the doctor will tell me the next thing to do. Then the doctor will also tell me some tests, important tests or examination that I'm supposed to carry on the client. Then some treatment to augment if I've already started. The doctor will say, okay, remove this, or put this to add to the treatment. Then if it is a client that I'm not supposed to handle, or a client that is somehow above my limits, the doctor will tell me, please refer this case.
The telehealth initiative not only supports the clients in the community who are the end users, but has given the nurses in these facilities the confidence to deal with any situation and has expanded their knowledge.
It's not only even for the benefit of the patients, mother, child, geriatric outreach and everybody. No, it is also for the benefit of the health care providers.
I will start with me because I'm the one doing the call. it has improved my knowledge in the practice. It has promoted my knowledge. It has created confidence in me that when I have any patient, any condition at hand that I cannot manage, I call them. If it is what they can manage, they will tell me what to do. If it is what I should refer, and I will refer immediately.
Before now, if we have some cases like this, to handle it will be difficult for us. We don't know. Sometimes we tell them to go out. But now, you just call a doctor. Sometimes call before them and give them the phone to communicate directly to the doctor. That makes him to have more relaxed mind as you know what you are doing. The community have raised, they are happy. This wasn't possible before the governor came with this initiative. Because we at the health centers, let me say myself at the health center, when the clients come and I see it as case I can't handle, I'll say, madam, go. I will not handle them because I don't want anything that will bring problem for me in the community. But with the telehealth initiative, I welcome the patients because I have that confidence that when I call the doctors, they will tell me, they will help me to handle that case. The community members, they now find it, instead of me going to the hospital far away or instead of going to the chemist, when you go to the health center, even if the sister cannot handle the case there, she will call the doctor. Doctors are working with them. So it has boosted our work in the center and the confidence that the community has in us.
I can reach them at any time. Even when I'm not in the office, my workers can use it.
In the midnight, early hours to once I call, somebody must pick the call, and they doesn't waste time before picking their calls.
I remember a typical dramatic instance just about the time we launched the telehealth. We provided vacuum delivery device for our matrons and birth attendants in the primary health care centers. So one of those matrons in the local government called Osisioma could not manipulate, and she had a delivery. She had a delivery, and the head of the baby had engaged, and she didn't know what to do. So she quickly dialed the call center, and the doctor picked up, and they put it on WhatsApp, and he said, okay, I can see what you are doing. Engage this way, do this way, and we had a self-delivery. It supports the healthcare provider and also supports the patients. This telehealth today has connected almost 800 primary healthcare centers we have, all of them.
Coming to the community, it has helped them, making health accessible and available, affordable to them at any time. Because this line that we use to give it's pasted in the front of my facility to all the patients that are coming here. When you have any need at any time, dial the number. Once you dial, please nurse, I have so issue. I will equally pick, just as telehealth do pick their own. I will pick and know why they are calling. So because of that, it has helped a lot to improve the health and the acceptability of the community people towards health. And another thing, it has reduced very well, reducing mortality rate in the community, and it is being welcomed by everybody. So because of that, it has made them at their comfort zone. They can call at any time before coming to the health center. Please nurse, this is what is happening to me. I want to come immediately. Or if it is what I will say, come. If it is what I will say, do this in your home. It will be solved. So it has really helped a lot.
A recent report published in the British online research journal, Scientific Research Publishing Incorporation, concluded that Abia State Telehealth Initiative, popularly called Dial a Doc, is an optimistic, veritable tool for reliable health information dissemination, health data gathering and exchange, effective community health policing, and reliable monitoring and evaluation of public health care service providers and provisions, with the singular objective to further strengthen and optimize our existing local health systems.
So Abia Telehealth has actually deepened healthcare delivery, and the impact of this was published in UK. That I think that journal described it as a smart and innovative way to deepen healthcare delivery in Africa. I have presented a paper in Rwanda in a conference called Digital Africa on Abia Telehealth. So it's recognized world over.
We want to use this opportunity to thank His Excellency, the Governor of Abia State, Dr. Victor Okezie Ikpeazu, for his profound commitment, for his political will towards this project. It's been incredible.
Dr. Okezie Ikpeazu value health so much. That is why he make this kind of provision to assist us in healthcare center, not to render services to the community. Our Governor Okezie Ikpeazu, we appreciate him. He helped us so much, the health workers. We are now working with confidence in the communities, and it has boosted our knowledge the more, because the more we talk to the doctors, they will be telling us the things that we don't know, how we handle our patients, and it helps us a lot. Then to the community members, they now see us as, what's the need of going to the hospital? The nurses are there at the health center, so let's visit the health center. So it has helped us a lot.
Our governor, Dr. Okezie Ikpeazu, before coming up with this project, I feel that he has a big dream for Abians, because these have really gone far to the grassroots to improve the health of the people, to improve the knowledge of the skilled health worker that is in the facility also. So because of this has made works easy and making people not to die just like that. You wake up and you say, hey, somebody have died, because they have a number that you can call at any time and say, look, this is what is happening to them.
I want to say a very big thank you to Dr. Okezie Ikpeazu for giving us such opportunity, because formerly we at times find it difficult to solve some problems. But now with this phone, we can get a prompt answer to some of the problems we cannot handle in our various PSCs. It's a very big thank you to you. Our governor, Dr. Okezie Ikpeazu, brought the dial doc so that those in the rural area will benefit for their medical care without spending money.
Using this telehealth service, Governor Okezie Ikpeazu has created a world where anyone can get Medicare from anywhere at any time, providing seamless health consultations that are local, reliable, timely, affordable, inclusive, and sustainable. Project 023, the Abia Telehealth Initiative.